On this episode of the STAT Regimen, breaking news on pharmacy-related reproductive healthcare access.
Hello, pharmacists and friends. Today is Monday, March 11th, 2024. Welcome to the STAT Regimen featuring breaking public health news. My name's Tony Sulo. I'm a sixth and final year Doctor of Pharmacy student at the University of Rhode Island.
And I'm Jeff Bradberg. I'm a clinical professor at the URI College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. The opinions expressed in this podcast do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
CVS and Walgreens pharmacy chains will begin stocking and dispensing Mifepristone, which is the most frequently used medication for medical termination of pregnancy and management of pregnancy loss or miscarriage. Prior to 2021, patients were required to obtain Mifepristone in person at a clinic, medical office, or hospital and could not obtain it at a pharmacy counter. In December of 2021, the FDA lifted that requirement, allowing for both telemedicine services to provide consultations and prescriptions that could be received by mail, and also allowed Mifepristone to be dispensed at pharmacies where state law permits. The FDA policy does require pharmacies and prescribers to meet certain requirements and complete a relatively simple set of forms to become certified to sell Mifepristone. That's the process CVS and Walgreens have now completed. Dr. Bradberg, what do you think about pharmacies now being able to stock and dispense Mifepristone?
I think it's fantastic any way we can expand access to reproductive health care, and I believe is a human right. I think that's great. I think it's great that we have, so many thousands of pharmacies able to do it. I hope that because the process is simple and because we'll see Mifepristone stocked by wholesalers, that independent pharmacies who I have actually interviewed are interested in stocking and dispensing Mifepristone, that they'll be able to do it. And of course, the final barrier is cost. We want to make sure that Mifepristone's cost is the same if it's obtained in a clinic or a hospital, or if it's prescribed by a physician and or a prescriber and picked up at the pharmacy. We know that there are some insurance companies that may cover the cost or will cover the cost, but I hope that public and private insurers expand their coverage to this essential class of public health medications.
Yeah, I agree. It's just another way for pharmacies and pharmacists to work with primary care and to advocate for women's health. It helps us solidify our role in comprehensive reproductive autonomy. So speaking of women's health, in other news, Opill is the first FDA-approved over-the-counter daily hormonal contraception. It was approved in July 2023, and its active ingredient is norgestrel, which is a progestin-only contraceptive. Opill has moved from prescription status to non-prescription status, therefore meeting the standards that the product can be used by consumers safely and effectively, relying only on the drug labeling without any assistance from a healthcare provider. It will be available in chain pharmacies such as CVS, Walgreens, and Rite Aid, likely sometime in April. So what should people know before purchasing Opill?
Well, according to the very helpful website, opill.com, the manufacturer will be selling 1 month and 3 month packs with a suggested retail price of $19.99 and $49.99 respectively. So that matches sort of what you'd see for prescription co-pays and things. So because this is over the counter, like other over-the-counter medications, Opill may be eligible to be paid or reimbursed through flexible spending or healthcare savings accounts, or FSAs or HSAs. OTC drugs are now, again, as we said, reimbursable in these plans, but they're subject to the limitations of the individual employer's plans. Tony, what else should people know?
So just in terms of some medication counseling prior to patients starting, they should know that they can start this medication on any day of their cycle, and that it does have similar effectiveness to typical prescription hormonal contraceptive, being that with perfect use, which means no missed doses and taking the medication at the same time every day, it's effective 98% of the time, and typical use is effective 91% of the time. Also, that research of Opill was conducted in teens as young as age 15, and to purchase, there are no age requirements.
Yeah, I think that's the greatest advantage here of going over-the-counter status. We saw this with a different kind of drug than these other two classes. We talked about Mifepristone, which is prescription-only medication, abortion, or pregnancy loss drug. Then we have Opill, which is a contraceptive taken every day. And then we have emergency contraception, which is only taken within 72 hours or 5 days. of in an event where you may become pregnant, so you need to take it within time span. So emergency contraception has been over the counter for a very long time, over a decade, and meets those requirements for over the counter use, is available without an age limit. So I'm very happy to see that we have no age limit for this now contraceptive, because it's so safe and effective. Be sure to follow at PharmDPubHealth on Instagram and connect with us on LinkedIn. Turn on post notifications so you never miss an episode. Smash that subscribe button now on Spotify, Apple Podcasts, YouTube, Amazon Music, or wherever you listen to podcasts. And again, that's at PharmDPubHealth. That's pharmacist and pharmacist, PharmD as in Dr. Pub Health, and spread the word.